Is expected to have a significant impact on healthcare, as you heard there, particularly here in Texas. The nonpartisan Congressional Budget Office estimates it could slash spending on Medicaid and the Affordable Care Act marketplaces by about $1 trillion over the next decade.
The CBO predicts that plan could lead to nearly 12 million more people losing their health care coverage, which would affect our state. KFF Health News reports that Texas has about 15% of its population on Medicaid. Here to help us understand more of that impact is that journalism outlet's senior correspondent, Renuka Ryasam. Renuka, welcome and thanks for talking to us today.
Thanks for having me.
We just mentioned that expected loss in healthcare coverage for potentially millions of Americans because of this bill. So first, explain how the legislation could potentially do that.
Sure. So this bill isn't a formal repeal of, say, the Affordable Care Act like we saw a few years ago where John McCain gave his thumbs down. Instead, this is a bill that takes aim at a lot of the architecture that keeps our healthcare system and healthcare coverage in this country in place. So, I think a lot of lawmakers, both Republicans and Democrats, would say that the way we finance healthcare, the way that we do healthcare in the U.S. Has a lot of issues. But this bill doesn't take aim at the sort of fundamental way that we do healthcare in the U.S. Instead, it removes a lot of the supports that help people gain coverage.
Your reporting shows the deepest cuts to healthcare spending could come from a proposed Medicaid work requirement. So explain that. What would those changes involve, and then how would it affect Texas?
Sure, of course. This is like I said, this is a bill that takes aim at the architecture. So in 40 states and the District of Columbia, they expanded Medicaid. So Texas is not one of those states. But in those states that expanded Medicaid, there's going to be a new provision if this bill passes that requires people who are in that Medicaid expansion population to prove that they're working, studying, volunteering, and there's some exemptions. For example, if you care for a child. And, most analysis show that this is going to be one of the biggest cuts to Medicaid coverage in the country. And this isn't really a requirement. I think a lot of Republicans who've supported this measure have said, oh, people who are on Medicaid should be working. But all the research shows that this is a requirement that doesn't actually help people get jobs. It doesn't help people stay employed. In fact, it's actually just a paperwork requirement. So people have to continuously prove and file paperwork to show that they're meeting these requirements. And states that expanded Medicaid will have to build entirely new technology systems, hire a lot more workers and bureaucracy to kind of deal with all that new paperwork. And a lot of people who are eligible for these programs will fall off the rolls, not because they're not eligible, not because they're not meeting these requirements, but because they can't do the paperwork.
Well, there is also a lot of talk recently about this bill hitting rural hospitals especially hard. Why is that exactly?
Sure. So another thing that this bill does is it takes aim at something called provider taxes. And this is super wonky, and I'm not going to go into all the details of it here, but basically it's, hospitals, providers, nursing homes, they pay a tax and they get that money back, and that helps them pay for the care that they deliver. This would hit Texas, the Texas Association of Rural Hospitals, and other rural entities pretty hard, because this is a way that these hospitals, these entities can get money to care for people. And this is a provision that a lot of states with big rural areas are really worried about. So in the Senate version of the bill, Republicans did put in $50 billion to help rural hospitals because of this provision and the way that it's structured. But there's going to be a lot of states competing for that pot of money. And there's some estimates. The House version of the bill, the Senate version passed really quickly, so there hasn't been a ton of analysis on it. But one version of this bill, one analysis said 300 rural hospitals would close, and that would hit Texas pretty hard.
Thanks for digging into that on the back end, and then of course the impacts we could see shortly in our state. We do want to ask you though, people may be wondering, what about my health care program? What about my plan? We know last year a record number of Texans got their health insurance through the Affordable Care Act marketplace, and you've reported the bill would make it harder for people to get and keep their coverage through this. So talk about what would change with that marketplace, and what changes might people actually see if this bill passes as it's currently written?
Absolutely. So again, this isn't like a formal repeal of the ACA, but what it does is make these changes again that make it harder for people to enroll and maintain their eligibility. So people who are in ACA, there's sort of this automatic enrollment, and now people are going to have to do more paperwork to prove that they qualify for these plans. And instead of sort of being automatically re-enrolled, they're going to have to go in and check and make sure that they're re-enrolled. So these eligibility checks, again, what they do is a lot of people fall off the rolls because they don't know about them, they don't know how to meet them, and sometimes they may not have the technology to do them. But one of the biggest, most immediate changes that people who are enrolled in ACA plans will see is that Congress in this bill, they are not expanding the enhanced subsidies that were passed during the Biden administration that help people afford these plans. So unless Congress extends those subsidies, which doesn't seem very likely, it's not in this bill, and they'd have to maybe do it in a separate bill, and that doesn't seem totally likely. Starting January 1st, millions of Americans will see their Affordable Care Act plans, the prices of those plans go up.
Well, Renuka Ryasum, we appreciate you so much for joining us, and I want to commend you and your colleagues there at KFF Health News because it's been such a great resource for us to be able to keep track of these impacts, but we appreciate you joining us to talk a little bit more about that, and maybe we will have this conversation again very soon, but thank you again for being with us.
Thank you so much for having me. I appreciate it.